Welcome to this presentation on the GP Contract and Primary Care Improvement Plan update for Renfrewshire HSCP as of the 12th of June 2019. I'm Chris Johnston, the Acting Clinical Director for the HSCP, and I'll be talking you through this presentation. The new contract was designed mainly to help improve the sustainability of primary care by helping alleviate the GP workload and make general practice more attractive to GPs. To this end, we have put in wider access to a wider range of professionals available in practices for people who do not need to see the GP and therefore reduce their workload. As part of the contract, the Health Board and the HSCP agreed to implement 6 different areas with the aim of improving the patient journey and reducing GP workload. This was called the Memorandum of Understanding. Over the next 3 years, the HSCP and the Health Board has been tasked with implementing 6 key areas to reduce GP workload. The first one of these is a vaccination programme. At present, GP practices do large amounts of immunisations for a variety of different reasons, and the intention is that over the 3-year period that all those vaccinations will be taken away from practices and will be done by HSCP and Health Board staff through dedicated teams. Secondly, we have pharmacotherapy, whereby large amounts of routine pharmacy work, which is done presently by GPs, will be done by staff employed by the HSCP, working in practices to take work away from GPs. Thirdly, the community treatment and care services will provide services to take away all the blood taking which takes part in practice at the moment. GPs provide their own phlebotomy service, and this will now be done by HSCP staff. In time, this will extend also up to other treatment room work, which includes dressing and removing of stitches. The fourth area to implemented was community linked workers. These see people who attend practices whose problems are more community-based or social or to do with benefits. A lot of GP time is taken up with this work, and having a community link worker can reduce their workload. Urgent care is about implementing trained nurses who can go and do house calls or deal with emergency patients in the practice to smooth over the GP day. And finally, we can also put additional professionals into practice, for example, physiotherapists and mental health workers, to look at areas that they could take work away from GPs as well. It's important to say that any service that will be transferred over will only be done once it's been assessed and it's safe to do so. The agreement between the Scottish Government and the Health Boards and the HSCPs, IJBs, and the British Medical Association describes how we will make sure that the contract is fully implemented, and there's a variety of aspects of this which are listed below. The PCPs require GP sub-oversight, and the implementation of the plan is monitored by the local medical committee, a branch of the BMA. However, the extent and pace of change to deliver all these changes to the ways of working in the next 3 years will be determined largely by workforce availability and training, competency and capability, and the availability of resources and premises to make sure that we can run this through the Primary Care Fund. Although the initial contract is set for 3 years implementation, the Scottish Government has put out numbers to say how much it's willing to spend over the next 4 years on this project across the whole of Scotland, and that is illustrated in this current slide. As you can imagine, this is a massive project to implement such large changes over such a short period of time. And to this end, there's a variety of assurance groups set up to make sure that the money is spent wisely and well and most appropriately on the contractual arrangements. Renfrewshire HSCP is very proud of how much we've been able to implement in such a short period of time. Already, all the housebound flu patients are dealt with by the HSCP rather than practices. All preschool community immunisation clinics are in place at the moment, and we're also doing school-based immunisations have been provided by the HSCP team as well. We have additional pharmacists and pharmacy technicians in most practices now, freeing up GP time. 10 practices are having their bloods been taken for by HSCP employed staff. We've had 2.5 advanced nurse practitioners working in practices, looking at doing urgent care in the practices. We've had 1.5 advanced physiotherapist practitioners working in practices, assessing people with joint pains and taking workload off GPs. And finally, we've also have community link workers in every practice. All 29 practices now have at least 1 or 2 sessions of these workers every week. We have implemented a lot of it very quickly, and the response has been very positive across the practices so far. In addition, we've used some of the monies to help practices look at how they deal with the workflow document training. This is a very important way to how much work can be taken away from GPs and look at all the letters and notes that come in on a regular basis. A further important thing to make sure is that the practices all know how to signpost. So as there are now different services available from practices, rather than the receptionist telling everybody to see a GP, it's important the receptionists know how to assess patients when they phone up and make sure they get seen the best person as soon as possible. This allows a much better patient journey, though sometimes people are not overly happy that the receptionists are asking questions about the reasons why they are phoning the practice. To ensure the implementation takes place as quickly and as appropriately as possible, we have something called an implementation tracker, which is being used to make sure the money has been spent properly and monitor the progress and speed at which we are going forward to achieve the aims of the new contract. The tracker is used to inform updates to the Integration Joint Board as well as the Scottish Government. After a very positive start to implementing the new contract in Renfrew HSCP, we look forward to implementing the same but more in the coming year. We hope to have more pharmacists and pharmacy technicians. We hope to expand the phlebotomy service so that all practices in Renfrewshire will have their bloods taken by HSCP staff. We hope to have another 2 advanced physiotherapists working in practices. We hope to increase the link worker resource, so to cover those larger practices and those in more deprived areas. And we hope to expand the vaccination transformation programme. Some of this work is out of our hands in the sense that it's done on a GCC-wide basis, like the vaccination transformation programme, but we have put ourselves forward as a site to pilot new ways of working for the whole of the GGC. Evaluation will be taken, led by Public Health centrally, of all the programmes so far. Implementing the new contract in full is not without its challenges. There are limited numbers of pharmacists and AMPs and physiotherapists to fill the roles available. The amount of time required from GPs to actually train attached staff can sometimes mean that the benefits of the staff is lost in the amount of time taken to train them. Accommodation space and practice in the community is limited, and as we employ more people, it's about where we can put them. IT is important in how much effort is required to change systems so that phlebotomists, for example, can take blood from one practice's patient in another practice. And there's also problems about how much money we would have if we were to actually implement everything in the contract. Would there be enough money to do this? These challenges and issues are continually being reviewed and discussed locally, at the board, and also nationally. In summary, over the 3 years of contract implementation, every practice locally will be supported by expanding the team of HSCP employed workers to reduce their workload. This will create a skilled multidisciplinary team surrounding primary care and will allow practices to refer on as appropriate rather than being seen by themselves. Practices will remain the heart of the community and often the first port of call for most people's problems. Change will happen bit by bit, it will not be sudden, and we hope we'll be able to bring everybody along at the same time. I think the emphasis really is on about the patient seeing the person who's most able to help them as quickly as possible. GPs may end up dealing much more with people who have multiple complex conditions. There are a number of services you and your family can refer to, and you can check these out on the local HSCP website or with ourselves. I hope you have found this presentation useful and helpful, and I look forward to answering any questions you may have when we meet on the 12th of June. Thank you very much.